Med history. Verruciform epidermodysplasia. This extremely rare disease has the scientific name Verruciform epidermodysplasia. The patient actually looks like a character from a horror movie or a fantasy series. The disease causes the formation of hard, woody, and growing warts on the human body, which are extremely difficult to get rid of. The most famous tree man in history was Dede Kosvara, who died in January 2016. In addition, 2 more cases of this disease have been recorded worldwide. 3 members of the same family from Bangladesh have been diagnosed with symptoms of this disfiguring disease. Verruciform epidermodysplasia, is a rare genetic disease characterized by the presence of multiple flat warts and scars on the skin. This hereditary disease is caused by a mutation of the EVER1 and EVER2 genes, which are associated with immunity to HPV, human papillomavirus. People with verruciform epidermodysplasia may experience excessive growth of viral warts on the skin, especially on the hands, feet, and face. These warts may be flat, smooth, or have an uneven surface. Although this disease is not cancerous, some forms of HPV can increase the risk of developing skin cancer. Treatment of verruciform epidermodysplasia is aimed at reducing warts and symptoms. This may include the use of topical medications, cryotherapy, surgical removal of warts, or other treatments. It is also important to regularly monitor the condition of the skin and consult a doctor in a timely manner if new changes appear. Reasons warty epidermodysplasia is a genodermatosis of papillomavirus etiology. In most patients, defects are detected in the EVER1 and EVER2 genes located on the long arm of chromosome 17 and encoding endoplasmic transmembrane proteins. Gene mutations increase the vulnerability of the skin to papillomavirus of certain serotypes. In patients with verruciform epidermodysplasia, about 20 types of HPV are identified, including HPV 3, 5, 8, 9, 10, 12, 14, 15, 19, 20, 21, 25, 36, 47, 49, and others. Sometimes several serotypes are detected simultaneously. Approximately 80% of patients are diagnosed with HPV 5 and HPV 8, which have high oncogenic activity. Infection occurs through microtrauma, inflamed skin, and mucous membranes. Most cases of genodermatosis are sporadic. A quarter of cases have autosomal recessive transmission, sometimes autosomal dominant and X-recessive inheritance is traced. Occasionally, the disease is not hereditary but acquired, and develops in patients with secondary immunodeficiency of various origins. HIV-infected, who have undergone organ transplantation and are receiving immunosuppressive therapy. Symptoms of verruciform epidermodysplasia. The manifestation of the disease can occur in infancy, 7.5%, preschool childhood, 61.5%, puberty, 22%, and adolescence. Skin lesions are polymorphic. The elements are flat, warty hypo and hyperpigmented papules, irregularly shaped plaques, foci of hyperkeratosis, dyschromia. Formations reach the size of a pea, 3 to 5 mm, but there are also larger elements. Their color may match the color of ordinary skin, or be pinkish reddish-brown. In addition to varicose elements, there are coffee pigment spots, lentigo. More often, rashes are located on open areas of the skin, face, neck, back of the hands, forearms, shins. Sometimes the axillary area, the perineal area, and labia are affected. Alopecia may occur in areas of the scalp affected by rashes. The elements tend to merge and form large conglomerates covered with a grayish-black horny mass. In advanced cases, overgrown warts become like tree branches, hence the colloquial name of the pathology arboreal man syndrome. Complications. In oncodermatology, verruciform epidermodysplasia refers to precancerous conditions. Papillomavirus genodermatosis can be complicated by Bowen's disease, bovinoid papulosis. Approximately 25–30%, according to some data, 60% of patients aged 30, 40 years develop non-melanoma skin cancer in sun-exposed skin areas, more often squamous cell carcinoma, sometimes basal cell carcinoma. Skin cancer associated with verruciform epidermodysplasia is characterized by perineural and lymphatic invasion, aggressive clinical course, distant metastasis leading to death. Treatment of verruciform epidermodysplasia. Methods of gene therapy of congenital dyskeratotic warts have not been developed. To date, only medicines and surgical methods are available to reduce the manifestations of warty epidermodysplasia with temporary success. The optimal therapy, its duration and frequency of courses are selected by a dermatologist. In practice, they are used, systemic and topical medications. Inside, immunomodulators, vitamin A, retinoids, interferon preparations are prescribed. Externally, ointments with keratolytic action, local retinoids, 5-fluorouracil ointment are used. The positive effects of photodynamic therapy with 5-aminolevulinic acid are described. Destruction of elements by physical methods. To achieve an acceptable cosmetic and functional result, wart growths are removed using cryotherapy, laser coagulation, electrocoagulation, and surgical excision. As a rule, repeated procedures for the destruction of warts are required. Prognosis and prevention. Currently, there are no methods for the complete cure of verruciform epidermodysplasia. Despite periodic medication courses and surgical removal of warty elements, relapses cannot be avoided. Even with a benign course, the disease significantly worsens the quality of life. Much attention in the management of patients with dysplastic variant of the disease is paid to the prevention of malignancy of the elements. To do this, it is recommended to undergo regular dermatological screening, protect the skin from direct sunlight with clothing and SPF creams. Preventive HPV vaccination is considered impractical since existing vaccines do not protect against those types of HPV that cause Lewandowski-Lutz verruciform epidermodysplasia.